Yes, really good to see you all, and how exciting you're almost there, graduating and going and do your apothecary after that. Very exciting, and congratulations for making it to this point.
Yes, they're still gonna go to the another examination though, pay for their apothecary degree. So wish you are still motivated to graduate to become a pharmacist, So shall we start for the and I'm gonna open this internal guest lecture formally, okay? So Mas Anton, do we have Pak Saptono here or?
Yeah. Pak Sap is not here.
Pak Sap is not here.
Okay. So my apologies, babe. Dr. Saptono Hadi, who is the head of the pharmacy department, is currently unavailable. He is having an examination for the Bachelor of Pharmacy, one of the mini research for the Bachelor of Pharmacy. So he sent his regards to you and a very, very, very warm welcoming to you, and very glad that you're here with us to give the lecture for today. So everyone, good afternoon, everyone. Today we're here for the international guest lecture by Dr. Tin Pei Sim. So Dr. Tin Pei Sim here, I will provide a little information about who is Dr. Tin Pei Sim. So Dr. Tin Pei Sim is a senior lecturer and the coordinator of international engagement at the Curtin Medical School, Curtin University, Western Australia. So this is the university where I'm doing my PhD, currently doing my PhD now. So at Curtin University, Western Australia. So I'm very proud of doing my PhD there, Faye. So Faye holds a doctoral degree in pharmacy. Dr. Tin Pei Sim is also a practicing pharmacist, community pharmacy owner, and she is one of the leaders in the pharmacies-led immunization services. So as you will know that in Australia, pharmacies can provide immunization services, unlike in Indonesia, compared to Indonesia. So she is one of the leaders in the providing immunization services. And she is an accredited mental health first aid instructor. So this is the most great achievement from Dr. Tin Pei Sim. That is, she is now the national president and chair of the Pharmaceutical Society of Australia board, and she is the first female, to be elected, to be appointed to this position since 1977. I'm right? Since 1977.
Yeah.
So if you all know, the Pharmaceutical Society of Australia is similar to what we call the IAI, Ikatan Apoteker Indonesia. So Dr. Tin Pei Sim is the president of the IAI in Australia. Okay, so that's similar to in Indonesia. Okay, so she's the president of the whole pharmacies in Australia. Okay, it's the same like in Indonesia. And she was appointed as the national president and chair of the PSA board in Australia. She was also served as the WA state president of the Pharmaceutical Society of Australia from 2017 to 2021. So that's a very, very, very high achievement for me, Faye. So because you're the first female and also from diverse background, multicultural background in Australia, and you have become one of the most, the president and the highest person in the whole pharmacies in Australia. So they can learn a lot from you to, how to become a very, very good pharmacist and those type of things. So Dr. Tin Pei Sim is also one of my supervisor, my PhD supervisor. So as you will know, she is engaging in many research, particularly in pharmacy practice, in diabetes mellitus, in minor ailments, primary care, vaccination, and she is fully committed to the pharmacy profession and passionate about the future growing of this profession. And she's very proud to become a pharmacist. I'm too. I'm very proud to as a pharmacist. So I think that is all about her achievement. I mean, she still have many achievements. I know. Maybe when we talk about face achievement, it will take, one day, more than one day to finish it. Okay, so today, Dr. Tin Phay Sim will give a lectures on the clinical intervention by pharmacists. And all of you, if you have any questions to Dr. Tin Phay Sim later on after the lecture is finished, then you may ask. And please ask, because I believe Dr. Tin Phay Sim will be very, very happy to answer your questions, because she's a very lovely lady and very, very kind lady. So please pay your attention, and time is yours, Faye.
Thank you, Vinci, for the very generous and kind introduction. You're too kind. But I do love pharmacy. That part is true. I do really love pharmacy, and I really love working and supervising Vinci as well for her PhD project. So like Vinci said, I'm very happy to take any questions after the lecture. Very happy to answer any questions outside of the lecture as well. If you have any questions, you can feel free to contact Vinci, your lecturer, and Vinci will get in touch with me as well. So I will be having an hour here with you this week, and then next week I have another hour with you as well. So this week I'm going to focus on medication reviews and clinical interventions, so more pharmacotherapy related roles by pharmacists in Australia. And then next week I will focus on immunization services by pharmacists. So both weeks I'm going to share with you what is happening here in Australia in terms of what pharmacists are involved with, to hopefully try and raise your interest and get you excited about what the pharmacy profession could look like. So I'll just share my screen. And I'm just checking that you all can see my screen. And I'm just going to turn it into...
Yes, I can see the screen. Yeah.
Is that in the presenter mode? Can you see?
That's in the... I think you need to... Yeah, I think you need to click the... Is it in the presenter mode?
Yeah. Can you see the whole screen with my presentation?
No, not yet. Not yet, right? Can you click on the display?
Let me just try again. I'll try this. Can you see that now?
Yes, I can see that.
And is that the whole screen?
It's not in the whole screen. There is still,
Start the slideshow.
Yes. Can you untick the use presenter view on top of the middle top there? Yeah, I think you're going on the to the right, right? Use presenter view. Can you untick that?
Where am I unticking? Sorry.
Rest left. Sorry. On the left, it's under the heading Acrobat. There is a use presenter view. Can you untick that? No, you're going on the left.
Oh, I think I'm
down. No. So,
I think we're seeing different things though.
Can you please go to the slideshow? The slideshow. Yep. Can you click on the slideshow?
Hang on, I'll stop sharing screen. I think what I'll do is I will share. I'll share the screen. Is that working now? Is that working now?
Yep. Perfect. That's perfect. Great.
Okay. Perfect. And you guys can see this now. Perfect.
Yeah. Sorry, Faye. Can I let the student know that she's not unmuting her? All right. Yes. You can continue.
And Vinci, just confirming you can see my screen now.
Yes. Perfect. You can see your screen.
Okay. Thank you. So today I'm going to focus, we're going to spend the next 40 minutes or so on medication reviews and clinical interventions by pharmacists in Australia. And as Vinci mentioned earlier, I usually like to declare my position. So I'm an academic here at the Curtin Medical School at Curtin University, which is in Western Australia, where your lecturer Vinci completed her PhD. And I'm the current national president of the Pharmaceutical Society of Australia and a community pharmacist by background as well. So today I'm going to talk to you about an overview of the pharmacy practice development in Australia, so you understand what's happening in Australia, but also giving you a background information about how pharmacists are really considered as medicine experts here in Australia, and how there is a change, a paradigm shift in how we practice pharmacy in Australia, and give you some examples of advancements and initiatives and programs happening here in Australia, the clinical roles, the types of medication reviews, what you do in the pharmacy, which is called meds checks and diabetes meds checks, and what you do with more complex scenarios, which are what we call HMRs or home medication reviews, and RMMRs, which are conducted in residential aged care facilities or nursing homes in some countries. That's what you would consider. But I'll go into those in a bit more detail later. I'll also talk to you about some clinical interventions and some types of medicine-related problems, and then we'll leave some time for questions. You will also find that on the bottom of each slide, where relevant, I've given you links to the relevant documents and web pages. So if you would like more information, you can refer to those links to read the full paper. So over the last 1 to 2 decades, there really has been a change in what pharmacists do in Australia. About 1 to 2 decades ago, pharmacists in Australia used to do a lot of dispensing and selling and supply of medicine. That was the major role at that time. But in the last decade in particular, or even more specifically, more recently, in the recent 5 to 10 years, pharmacists in Australia are now doing a lot more patient-centered care services. So what patient care services mean is that services where the pharmacist actually involve a patient and talk to a patient and have that patient focus, patient front engagement. And this happened because in Australia, there is what we call the National Medicines Policy and the Quality Use of Medicines, or QUM policy, but also because medicine safety has been regarded as the 10th national health priority area only just about 4 or 5 years ago. So what this means is that, imagine medicine safety being a national health priority. It means that the government will work towards ensuring that medicine can be used safely and effectively in any clinical settings. And if we agree that pharmacists are medicine experts, out of all the health professionals, including doctors, pharmacists are the ones with the pharmacology knowledge and the pharmacotherapy knowledge, and we are actually medicine experts. And therefore, if we want to achieve safe use of medicines in all clinical settings, then we need to put pharmacists across practice settings. So we need to see pharmacists in a community pharmacy, we need to see pharmacists in a hospital, we need to see pharmacists in aged care facilities or nursing homes, we need to see pharmacists in GP clinics with the doctors, we need to see pharmacists in all other clinical health services. So this is to show you how the role of pharmacists in medicine safety has really evolved over the last 1 to 2 decades. But also we have to consider in the last 5 to 10 years, this is worldwide, including in Indonesia, there are so many new medicines produced by pharmaceutical companies. Like right now, there are so many more monoclonal antibodies, for example, for autoimmune conditions on the market now compared to 5-10 years ago. And because there is constantly new medicines coming out on the market, the role of pharmacists will continue to evolve, because pharmacists needs to be the person with, the knowledge to actually ensure these new medicines can be used safely as well. The other thing that is happening in Australia is the down-scheduling of medicines, of some medicines. So what that means is, in Australia, we have a scheduling system. And what that means is certain medications are classed under different categories, whereby they will need a prescription from the doctor, or they can be available over the counter. I know through Vince's PhD work, you have a very similar system in Indonesia as well, but the classification can be a little bit different. But in a similar way, we do have the classifications in both Australia and in Indonesia. But what we're seeing in Australia is to try and improve people's access to this essential medicine, to remove as much barrier as possible. There have been a lot of movements to down schedule some medicines, which means patients do not need to go and see a doctor to get those prescriptions. So a good example of that is migraine medicine. So triptans, like sumatriptan, for example. So you may have learned that triptans are very good anti-migraine treatments. In Australia, it used to be on prescription only. But to try and increase access to this essential medicine, this medicine has been down scheduled, which means it can now be available over the counter, provided by a pharmacist with pharmacist intervention, without the patient going and see a doctor. So you can imagine this is just one class of medicine, and there are so many other things where down scheduling can happen. And therefore, if down scheduling occurs, then there needs to be pharmacist involvement. There is also increase in generic prescribing, and you would know if you work in the pharmacy now or in hospital in Indonesia, you would know that a lot of medicines now come as generic brands. And of course, sometimes generic medications comes in different brand names. It can cause confusion to patients. So pharmacists will need to be involved to make sure that these are talked through so patients know how to use them. There is also a shift towards competency-based training. And what that means is it's not just one exam to determine if someone is a pass or a fail as a pharmacist. It's competency-based, which means we literally list down exactly what the competency standards are, and then train pharmacists and train students based on those competencies that we want them to demonstrate. Also, there's continuous development of practice standards, professional services, and also lately, especially in the last 2 years, we know that there's significant change in patient and consumers' health-seeking behavior. We all know that in the last couple of years, we have had COVID around the world, and that has actually, stop or cause, impede access to healthcare services because people are not able to get to their GP. And because of that reason, people are coming to the pharmacy more and seeing their pharmacist. So that naturally allows pharmacists to play a bigger role in the healthcare system. In Australia, it wasn't just COVID-19. In the last couple of years, we've also had a series of natural disasters like bushfires and floods and tornadoes and cyclones. So all of these emergencies might mean that it can make it difficult for people to see a doctor or other healthcare services, but pharmacies are always there. So those are the reasons why there have been a complete shift in pharmacy's role over the last 5 to 10 years in particular. I do want to now outline, pharmacists are medicine experts and the skills and expertise should be fully utilized. And I want to talk a little bit about how is community pharmacy in Australia quite different to other retailers, because people might have the image that a pharmacy is a retail outlet because you sell things. But in Australia, there's an increased change where we consider community pharmacy as a health destination, as opposed to a retailer. So the difference here is that retailer literally sell things, but in a pharmacy, many products and medicines are not ordinary items of commerce, which means it needs a pharmacist, a health professional's involvement and professional discretion to make sure that this medicine or this product is safe and effective for the person. Even if that medicine or product is safe for them, they still need to make sure that it can be used correctly with the right directions for use in order to make it effective for the person and safe for the person. So that is something to point out, that there is a complete movement. Again, I've noticed this not just in Australia. When I was at the FIP Congress, which is the International Pharmaceutical Federation Congress in Spain in September this year, we also met your leaders from IAI from Indonesia there as well, which was very exciting. But I got to meet with many other pharmacy leaders in other countries, and we all agreed that there is an increased movement for pharmacists to be doing more, for community pharmacists to be playing a bigger role in the healthcare system. So I suspect that moving forward, in Indonesia, for example, in order to sustain the health system in Indonesia and better equipped and better use the skills of healthcare professionals, there may be a shift in the role of pharmacists in Indonesia as well. And I would encourage you to have a chat to your lecturer, Vinci, as well, because her project is very topical in this area. So I mentioned earlier that there's a complete paradigm shift in pharmacy practice now from product-based services to now going into medication-related needs and patient-centered services. So what this means is that it's not just about the sale and the supply of a medicine or a product, it's about how medicine is used and how we can provide patient-centered services. This is actually something I wanted to share with you, and I've given you the full link here. If you just copy and paste this link in your own time after the lecture, you can download a full copy of this report. It's actually a report from our organization, from the Pharmaceutical Society of Australia. It's called the Medicine Safety Report. So what the Medicine Safety Report is, it outlines the role of pharmacists in medicine safety, but it also talks about, in Australia, the percentages of medicine-related hospitalizations. In other words, people who took medicines and took medicines incorrectly or with side effects and all that, that has led to them going into hospital. And when that happens, obviously that's a medicine safety concern. And the paper is actually really good because it outlines how important medicine safety is. So I would highly encourage you to have a read. It is about the landscape in Australia, but the concept will be relevant to any country. So I do recommend you to have a read. And also, when you go onto the link, if you're interested, you can see that the Society has now produced a series of what we call medicine safety series reports. The first one on the left-hand side was the generic version outlining what the problems are in Australia about medicine safety and the role of pharmacists to prevent, medicine-related hospitalizations and preventable hospitalizations. And the second one focuses on aged care. So that is about medicine safety in the elderly population, the older people, but also about medicines management in residential aged care facilities or nursing homes. And the third paper there focused on rural and remote care, because we know that in rural regions and remote regions where access to care is a problem, people can't get to other healthcare professionals, then medicine safety becomes a bigger problem as well. So the paper talks about that. And the fourth one is on the medicine safety being a national health priority area. And the last one is on disability care, which is our fifth report that only just got published and launched in July this year. So that focused on pharmacists improving the safe use of medicines in people living with disability. I would also like to encourage you in your own time after the lecture to copy and paste this link and get a full copy of this report. So this is a report, again, that talks about pharmacists in 2023, what we expect pharmacists to be fully doing by 2023 in Australia. It really talks about the role of pharmacists in the various areas when it comes to medication management, medicine safety, and advanced clinical practice. Also, I've given you a link here to the Pharmacy Guild of Australia's Community Pharmacy 2025 report, which is a framework for change that talks about community pharmacy in 2025 and how to actually allow community pharmacy to be a health destination to provide care to local communities. So if community pharmacy is your passion, I do also highly encourage you to have a read. Now, I mentioned earlier that pharmacists in Australia work in different places to altogether improve medication safety and medication and undertake medication review. So what are the roles in Australia if you're interested to know? So there is community pharmacy, hospital pharmacy, specialized compounding pharmacist. There's also accredited consultant pharmacies, industry pharmacist, general practice pharmacist, which means pharmacist that works with the doctor in a GP clinic. There is also aged care pharmacist that specializes in geriatric care or aged care. Drug information services pharmacist, where people can ring up when they have an overdose or they want to ask about certain information about the safety of medicines or products. There's military pharmacists as well. So pharmacists that works for the military, the army. And there is also academic pharmacist that works at universities and tertiary teaching institutions that who does teaching and research. There's government area as well. So pharmacists are involved in policy and administration in government, but also in specialization like credentialed diabetes education, and the list is continuing to grow. So pharmacists, I mentioned earlier, are medicine experts. So pharmacists actually undertake a lot of medication reviews. So in the community pharmacy, if someone walks into inside of the pharmacy, when a pharmacist provides a medication review, in Australia, it's called a meds check or a diabetes meds check if it's specific about diabetes and that your patient actually has diabetes at the same time. So what this involves is someone who walks into the pharmacy, we have certain set criteria. If they're on 5 or more different medications, if they have any recent hospitalizations or any recent significant changes in their medical conditions or medical histories, then they're entitled to a meds check. So what that means is that it's a service whereby the pharmacist will sit down with the patient and spend about 20 minutes to even 30 minutes or 40 minutes per patient, and go through every single medication that the patient is taking. So if the patient is on 10 different medications, the pharmacist will go through all 10 of them, ensuring that the patient knows exactly how to take the medication, what the medication is for, and check to make sure that there are no interactions, no precautions and contraindications. The doses are all correct. Do you need any dose adjustments based on the patient's renal function or hepatic function? So basically going through to check to make sure that things are, anything to do with medicine is actually all good for the patient. And then what happens is the pharmacist will write a report, and the report will be given to the patient and also sent to the patient's general practitioner, so the patient's doctor or GP. And often the pharmacist will make certain recommendations, such as if any drug interactions was identified or if there was any de-prescribing required. So de-prescribing is the opposite to prescribing. Basically what de-prescribing means is that if the patient is on 10 different medicines and through this medication review process, you identify that the patient is on 2 medicines that they do not need to be on, then you would recommend de-prescribing. So de-prescribing means you put forward recommendation to say, patient is on this medicine that doesn't have a clear indication or a clear need, or patient was put on this medication such as antifungal cream, as simple as an antifungal cream, since 12 months ago for a fungal infection, but the fungal infection has cleared, but nobody told the patient to stop using it. So there are certain times when you have to demonstrate de-prescribing. Or if someone is experiencing a side effect from a medication, then the pharmacist might recommend de-prescribing or dose adjustments and monitoring requirements. Now, however, at times, if the patient's medical history and medications are more complex, or they're not able to come to a pharmacy, an accredited consultant pharmacist in Australia can actually go to a patient's home and undertake what we call a home medicines review, or HMR. It is also a medication review, but it's conducted at the patient's home. So imagine the pharmacist, if you are the consultant pharmacist, you will go into a patient's home, sit down with them, go through their medication cabinet if they feel comfortable in doing that. So go through all of the medications, same thing, do the counseling, make recommendations, and write a letter to your GP. And also, there is this program called the RMMR, which stands for Residential Medication Management Review. And this is also a type of medication review, except this is conducted at a residential aged care facility or a nursing home. I think in Indonesia, it's considered as a nursing home. And it basically is a review of medication conducted by pharmacists on the residents of the aged care facility. Now, the next few slides, I'll go through it quite quickly because it's a summary for you to understand those programs. And I think what is quite important to point out is that these programs are actually fully funded by the government. So patient does not have to pay anything to access this service, and the pharmacist will be paid by the government to do this service. So it's a program that is fully supported by the government, which is an excellent program. So this slide here summarizes the meds check and diabetes meds check services, where it involves the provision of in-pharmacy one-on-one discussion. It's one-on-one between the pharmacist and the patient, but the patient can also bring in any carers or their spouses, their family in with them if they wish to do so. So it's about a discussion about and review of the medication, and it's about aiming to address any concerns or questions that the person has about their medicine. So on this slide, I don't expect you to read this in detail now, but what I'll do is I will send a copy of these slides to Vinci, your lecturer, later, so Vinci can share with you all. I'm happy to share the slides with you all. And it's just a summary of basically what I've explained to you about what is a meds checks and what's a diabetes meds checks. In other countries, like in Canada and in the United States and in the United Kingdom, and even in New Zealand as well, they have very similar programs. It might be called a different name. It might not be meds checks or diabetes meds checks, but it's a very similar program. So I do recommend that you have a read so you can get your understanding about what pharmacists do, and hopefully one day in Indonesia, a funded service like that can be conducted as well in Indonesia. And also, if you're interested, I've given you a full link here to the guidelines for pharmacists to provide meds checks and diabetes meds check services. So if you're interested to know a bit more detail about, if I'm a consultant pharmacist, if I'm a community pharmacist, if I want to provide this service, what do I do? What are the steps that I undertake? How do I ask questions about the patients? How do I conduct a medication review? So this paper here talks about all of those information. So I would definitely encourage you to do that. Now, this is a slide here that summarizes the flow in which how services are being provided. So starting from the top, you can see that the first thing that needs to happen is that the pharmacist must identify that there is a need for this service to be conducted. The pharmacist then determine if the patient is eligible. Then the pharmacist get consent from the patient or agreement for the patient for the service to be conducted. And the pharmacist would then do the first thing, which is called reconciliation of medication. So medication reconciliation or reconciling medicine, it means asking the patient to obtain an accurate list of all the medicines that they're taking. Because if the patient goes to multiple pharmacies to get their medicine and they visit multiple doctors, there might not be one place where all the medications that they're taking is on the one list. And sometimes patients might be confused themselves as well. So the first step is always to do a medication reconciliation. So what that means is it is a process whereby you find out from multiple sources, through asking them verbally, through asking them to share with you any reports from their doctors, through asking them to bring in a bag of their existing medication so you can see the boxes and read the labels to confirm this is in fact what they're taking. And then you produce a full list, a complete list of medicine that the person is taking and the dosages and strength and directions for use. Once you've got a full list of accurate medicines that they're taking after medication reconciliation, you're confident that you know everything the person is taking, then you proceed to counseling communication. You make sure that patient knows what they're for, what they're using it for, and then you review it to check that there are no drug interactions, there are no issues in relation to precautions and contraindications. And then you would communicate with the patient and the doctor as well, and you'll write a report. You document that, write a report, send it to the patient, send it to the doctor, and then you would do subsequent follow-ups and monitoring, and then always go back to quality assurance and evaluation. This slide here summarizes what I talked about earlier in relation to home medicines review. So this is about medication review conducted in a hospital, home, in a patient's home, which is what I've talked about earlier. But that's if you go to that slide, you'll be able to read everything about this service. This slide here is about residential medication management review, or RMMR, and quality use of medicines. Again, for residents who live in a residential aged care facility, for you to have a read. Now, this is an interesting one. So this is called clinical interventions. So this is a separate program where pharmacists are involved in. It is the formalization of the clinical role undertaken by pharmacists practicing in a community setting. And basically what this means is that when someone comes into the pharmacy with any request, with a new prescription or with a request for any medicines over the counter, and you have had to intervene to make sure that the medicine is used safely. So say, for example, if there was an overdose on the prescription, if there was a drug interaction, if they did not use their asthma inhaler well, the inhaler technique was poor, anything that requires your intervention as a pharmacist, you then record this as a clinical intervention. And at one point in time, or a few years, this service was also funded by the federal government. So pharmacists actually get paid when they conduct any clinical interventions. However, this program actually stopped in terms of funding on the 31st of July in 2020. So pharmacists are no longer paid for this service, but pharmacists are still doing this service. Not ideal, I know pharmacists need to be paid, but pharmacists are already trained up to undertake clinical interventions. And if you're interested in knowing what pharmacists are involved in when it comes to performing clinical interventions, here is a link to the paper for you to have a look. And also you can see here in the flow chart, we talk about how to undertake a clinical intervention. So first of all, to identify what we call an MRP. So MRP means medication-related problem. So any problems, any clinical problems relating to a medicine, whether it is on a prescription medicine or a non-prescription medicine. And then the pharmacist will perform that clinical interventions and then document and record the interventions and then undertake follow-up and subsequent review. In the paper, in the full report, it talks about the steps for every single part of this process, which I'll let you read. This slide here is quite interesting. It might be a bit small on your screen to have a look, but I wanted to talk to you about the different types of medication-related problems. So when can things go wrong with medicine, right? When can things go wrong? It could be category number 1D, which is drug selection. It could be that a wrong drug was selected because it was a duplicated drug, because there was drug interaction, it was the wrong drug, it was incorrect strength or inappropriate dosage form, or there's contraindication or there's no indication. The second problem could be, it could be an overdose or an underdose being prescribed. If it's an overdose, it's not going to be safe for the patient because they're at risk of more side effects and toxicity and possibly even death. But if it's underdose, it's not safe either, because if it's underdose, it means, and if it's under therapeutic dose, the patient's medical condition might not be adequately managed. So for instance, if they have an infection and they've been given an antibiotic that is an underdose, they're not going to get overdose effects. But if it's underdose, it's equally as harmful because it means that the infection will not be cleared because the drug will not be effective. So both overdose and underdose are quite critical, equally critical. And C is for compliance. So there could also be issues in relation to compliance or medication adherence. They might not be using the medications as per how they're told. They might be taking too much, too little, might be forgetting to take the tablets. They might be using their inhalers or their devices incorrectly. So there could be a lot of issues in relation to compliance, adherence, and how they are engaged with their medicines. There could also be another condition called undertreated condition, which means that if they have certain medical conditions, now that you've learned pharmacotherapy, if you know that, for example, if they have heart failure, have you learned heart failure? I think you may have learned about heart failure. So if you've learned about heart failure, for example, or if I use the example heart attack, if someone has had a heart attack, so let's say a STEMI, an ST elevated myocardial infarction. If they've had a heart attack, in pharmacotherapy, you would know that they need to be on SARB-GT, right? They need to be on a statin, they need to be on an ACE inhibitor, they need to be on the combination of therapy. But if they're not on that combination therapy, it means that the condition might be undertreated, which is not good because, again, the condition is not well managed. M is for monitoring. There could be issues in relation to needing the condition to be monitored and side effects to be monitored. Or it could be about educational information, that you identify the patient needs to be given more information and education about their medicine. Or it could be just not classifiable, or lastly, toxicity or adverse reaction. So it could be that someone comes in and told you about a sore throat that they have and a fever. And then when you ask questions, you actually realize that it's not because of COVID, it's not because of a viral infection, not an infection, it was because they have recently started on methotrexate and they were using too much methotrexate. So methotrexate must be used once a week, but let's say they're using it every week and they're starting to show signs and symptoms of methotrexate toxicity or adverse effects. So that's also another thing that pharmacists will pick up regularly on. And on the right-hand bottom column, you see recommendations. So often what pharmacists would do is after they've identified any clinical problems, they would undertake clinical interventions, which means they'll make recommendations. And the recommendations could include change of the therapy, change of the medicine, making a referral, providing information, recommending monitoring or undertaking monitoring, or sometimes there might not be any recommendation necessary as well. Now, this is, again, a flow chart to show you how you can see on the right-hand side there. I talked about drug selection, over and underdose, compliance, undertreatment, monitoring, education, things that are not classifiable, and toxicities and adverse drug reactions. So just for you to have an understanding about the process that pharmacists would undertake to find out and undertake and perform a clinical intervention. Now, this slide here is to talk to you about, in Australia, there is a medication management training program that pharmacists would do to become an accredited consultant pharmacist so they can do complex medication management review and become a residential aged care pharmacist. So if you are interested, again, you can have a look at the courses that are available here and perhaps do something similar in Indonesia as well. So they're very specific courses trying to train up pharmacists to undertake complex medication management reviews. This is a good news to share with you all. So it was this year that the government confirmed in Australia an investment of 345.7 million Australian dollars over 4 years, a period of 4 years, to put a pharmacist in aged care facilities. So the role of pharmacists in the aged care facilities then is to make sure that pharmacists are able to contribute to improve the safe and judicious use of medicines in aged care facilities. So this is still relatively new for us, but very exciting opportunity growing. So there will be lots and lots more job opportunities here in Australia in the coming 4 years. This slide is to share with you that we also have a program here called Pharmacists in General Practice, where pharmacists are in the same GP clinic as a pharmacist, as a doctor, and where the patient is taking a lot of medications with very complex medication history. The GP will make a referral so that they can come and see the pharmacist based in the GP clinic. So they're actually what we call general practice pharmacists. So they have been proven to be very useful. So GP pharmacists have been proven to be very useful to improve medicine safety focus, to improve transitions of care in and out of hospital and home, and reduce rehospitalization and hospitalization, and also undertake collaborative prescribing pilot, which means for certain conditions, pharmacists might be able to, under the supervision of a doctor on certain conditions, prescribe certain medications. And lastly, I also do want to touch on this. This is the telehealth medication reviews. So we know that during COVID, where we're trying to have people in isolation and limit contact to prevent the spread of COVID-19, telehealth was done quite a bit here in Australia. So basically what that means is to utilize technology, a bit like what we're using today, via screen, via the internet, whereby the pharmacist can speak to and talk to patients on the other side of the screen, but still able to conduct medication reviews, but via Zoom or telephone calls and or Teams. Okay, so that's the end of my formal presentation. So I'm very happy to take questions, and I will stop sharing my screen so we can see each other. Yes, so I'm very happy to take any questions either now or later on. If you have any questions, you can pass that on to Vinci.
Thank you very much, Faye, for the insightful lectures today. So the students might know the differences between pharmacists and practicing in Australia and also practicing in Indonesia. I guess because you also explained there are also so many roles that pharmacists can take on, like military pharmacists, GP pharmacists, aged care pharmacists. So for those of you who are confused, what is a aged care pharmacist? It's similar. Aged care is similar to nursing home in Indonesia, which is, we call it panti jompo. Okay, so in Australia, aged care facilities are also one of the facilities that the government provide. And I think you have shown us the slide that there's a pharmacist specialized in the aged care as well in there. So we have not had any pharmacists in aged care yet currently in Indonesia. So it's very good for them to know that there is also pharmacists specializing in aged care, particularly when they're elderly, that they have more complicated medications compared to the normal patient that normally pharmacists see. So maybe some of you have questions to Dr. Tin Pech Sim. You can raise your hands and you can try to speak in English, but if you can't, then I'll help you to translate it so Faye may know what are you asking. So who's going to ask first? Any of you wants to ask about how the pharmacist is practicing in Australia and what's the differences? And I just saw that they're having a clinical intervention as well, Faye. So this is also interesting for the students as well when they're practicing, because later on we have what we call the competency examination for the pharmacists in Indonesia, which will be conducted similar to the doctor competency base, where if they can't pass the examination 3 times and they're not allowed to become a pharmacist, that's the new regulation for the in the next year, in the next 2 years. So we're still having that regulations on board and taking on board by the. Okay, I think there are many questions from Ofira, Mela, Mariam, Adinda. Okay, where should we start? Ofira, you can start first.
Okay, hello, good afternoon. My name is Ofira. I am actually very interested in the history of pharmacy practice in Australia. And actually, I have 2 questions. Is that okay, Bu Vinci?
Yes, that's very
okay. The first question I want to ask to the Dr. Fazim is that this is about the shift that occur in pharmacy's role or pharmacy practice in Australia. And this is related to the shift towards competency-based training or practice standards. And my question is, the first question is, who is setting the standard? Who set the standard? Is it by the law and policy from the Australian government, or is it by the Pharmacists Association meeting? That's
a very good question, Ofira. Very lovely to meet you, Ofira. Very good question. So to register as a pharmacist, the competency standards, it's set by, it's documented in what we call the National Competency Standards Framework in Australia, which is a standard and a report with multiple organizations involved coming to a consensus. So the first body that is involved, so it's all a range of bodies coming to a consensus. So the first body is the Pharmacy Board of Australia. So to register as a pharmacist, you need to be registered with the Pharmacy Board of Registration, Pharmacy Board of Australia. So they are involved. There is also the Australian Pharmacy Council, which are the council that sets the accreditation standards for university courses and any subsequent training courses. But also for then, in addition to that, for very specific pharmacy services like immunization or Webster packs or dose administration aids, where you pack medicines into individual packs, or any sort of specific service that is set by the society. So it really depends. It's quite confusing because governance in pharmacy in Australia is very complex. There are so many different bodies and organizations, but the main competency standards for all pharmacists is set by a consortium, by all of these different organizations coming to a consensus to produce that report. So multiple areas.
Interesting. Thank you for the wonderful answer. I also have one more question for you. This is also about the shifting of the pharmacist's role, and that now in Australia, pharmacists already entitled as professional medic manpower. And they can even have the power to recommend or allow to sell a few more drugs without the doctor's prescription. And in my opinion, it's such a great news and such an enlightenment for the pharmacists, either in Australia or in Indonesia. But however, in my area specifically, people still tend to look us down and still consider us only a drug seller, only a medical drug seller. And sometimes it affects our confidence, or at least it affects my own confidence. Some people might be the pharmacist, or might be us, the pharmacy student, feel a little bit jealous to other professional medic manpower, such as doctors, nurses, and the other. And because of that social stigma that we only be able to sell drugs and that's all. And do you have any inputs or maybe tips or trick so that we can put ourselves high and feel the professionalism? Thank you so much.
Well, Farah, I'm impressed that at this stage of your career, you've already identified this issue, because this is not just in Indonesia, it's everywhere. Because for many years, pharmacists' role have always been about supply and selling of medicines. And then what needs to happen is a change in the attitudes and perspectives of patients and consumers and the public, because the public needs to recognize that we are medicine expert, and they need to recognize our roles, and we need to have that recognition before the respect will come. So to me, it needs a multifaceted approach, right? First, and it's a journey to get there. It's not going to change overnight, but I think number one, through research, you will see that, even through Vinci's research and a lot of other pharmacy practice research, we often run pilot projects where we pilot this and then we gather data to prove the impact of pharmacists. What is the impact of pharmacists when they do this? So when you have solid evidence like that, at the society, we then advocate for pharmacists. We'll take that to the government, to funders, to policymakers, and tell them, look, you must support this, because pharmacists are able to save your government X number of dollars, because we can stop hospitalizations. We can, reduce unnecessary GP and emergency department presentations and things like that. And then if the government and the policymakers support us, they understand and appreciate us, and they start to fund us, if they can participate in campaigns. So if it comes not from the pharmacy profession, but comes from the government, and say, if you have stomach ache, if you have a rash, if you have indigestion, if you have any minor ailments, any condition, or if you need your diabetes to be monitored or whatever, go to your pharmacy first. Get the pharmacist to look at you first and help you. If it doesn't help after 3 days, 2 days, 3 days, follow the advice of the pharmacist. If not, then you go and see a doctor and so on. So I think there needs to be that top-down approach to guide the community, because usually the community will listen and go, oh, if the government tells me so, surely there is reason for why they're doing that. But also I think COVID-19 is terrible, but it's actually, it has been positive to help pharmacists raise their profile. Because when people are not able to get to their doctors, they can still come to a pharmacy and they rely on pharmacists. So in fact, through Vincey's work, Vincey might share with you in another forum, but through Vincey's work, there was demonstrated, a change in the behavior of consumers, that they're more understanding now about the role of pharmacy. So I think there needs to be a lot of public education. Did you know that pharmacists don't just put a label on the box? Did you know that we don't just sell medicine? Do you know why does it take so long? Because someone would say, I've given you a prescription, or I just asked for this medicine. Why is it taking 5 minutes? You're just taking it from the shelf, but they don't understand. We have to check everything, right? Is the right dose for you? Is the right medication for you? There are no interactions according to the history. So I think it's a journey to get there. So I think in terms of pharmacy practice worldwide, the US, UK, Canada, Australia, New Zealand, these are the countries where practice of pharmacy is probably a bit more advanced. And I think there's a lot of opportunity for these countries to help support the practice of other countries to bring everybody along. So it's a journey, absolutely a journey.
Okay, thank you so much, Dr. Facing.
So we are proud to be a pharmacist, and you have to be confident that that's the message. You have to be confident, and we all can do it with also with government help and with convincing the public, the community, that pharmacist is not just selling medicines, but it's also an expert in the medicine special. So moving on to the next questions, there are 3 questions. I think there is also 4, but I'll go with Mariam Nur first. Mariam Nur, you can unmute your, you can go. Yep. Can you speak louder, Mariam? Hello, Mariam. Can you speak? Can you get closer to your monitor or to your speaker? Yep. Okay. Yep. Mariam, does anyone can hear Mariam? I still can hear her.
Yeah, I can't hear Mariam as well. Perhaps Mariam can type in the chat.
Okay. Or if you have difficulties with your speaker, you can type in the chat box, Mariam, and I will rely you. Sorry? Mariam, if you're having difficulties with your speaker, you can chat in the chat box and I will relay your question to Dr. Tim Faisim. Is that okay for you? Or should we go to the can you chat in the, can you write in the chat box, Mariam? No, it's, your voice is not clear to me, and I think it's not clear to you as well, Faye.
Yes.
Yeah. Okay. So, Mariam, can you please write your question in the chat box, and I will move on to the second question. Is from Meila Tunjung Suryaningrum, yes, and then after that Adinda Putri. Okay, Meila, you can start asking your question, please.
Okay, thank you, Miss Vincey. Hello, good afternoon. Before that, apakah suara saya lancar, Vincey?
Yeah. Yes. Can you speak louder again, Mayla?
Okay, good afternoon, Ms. Wei. My name is Kunjung. I'm sorry for my English ability, but I hope you understand my question. My question is only one, and that is, what should pharmacy Australian do to acquire the basic skills that set by the pharmacy guideline or something like yang guideline in there? Is it the same as in Indonesia? You have to take education at the professional level or bachelor level? I think it's my question. Thank you.
Mayla, can you repeat your question again, please? I can hear you clearly.
Okay, I will repeat my question. What should pharmacy students in Australia do to acquire the basic skills set by the Pharmacy Association guideline in there? Is it the same as Indonesia, who have to take education at the professional level? Is it enough, Ms. Cindy?
Yes, sure. Have you? I'll repeat her question, Faye. So, what's the differences between the pharmacy students and in Indonesia and in Australia? So, basically, what do those pharmacy students in Australia needed to acquire their skills and knowledge to become a pharmacist? Are there any differences? I suppose there are many differences, I know, but maybe you can mention some of them. So they have a little bit of picture of understanding of how advanced those pharmacy students in Australia compared to Indonesia.
Yeah. So there's a few things. So starting from the undergrads is it's 4 years to do the undergrads Bachelor of Pharmacy degree, and then straight after that there is a 1 year what we call an internship program, which I believe is your apothecary, the equivalent of your apothecary. So you do 1 year internship and then you register to be the basic pharmacist. But if you then want to conduct the home medicines review and residential medication management reviews that I talked about earlier, more specialized medication management, then you need to do specializing course to become accredited. And you do that sort of part-time when you're working, and it really depends on how long you take to complete the case scenarios. But if then people go into different specialization roles, then there are different credentialing that they will need to undertake. Another pathway potentially is for someone with a basic degree in health or in biomedical sciences or any health areas. And then they come in and do a master's degree, a graduate entry master's program in pharmacy. And then you still have to do, which is usually about 2 to 3 years. And then you have to complete the intern training program as well and do everything else as well. But if Melia, if there's anything specific, any area specifically that you're interested in, have a think about it. I'm very happy for you to come back next week and we can address that if there was any specific pathway that you're looking at that you're interested in.
So that's 4 years undergrad program, and then they become a pharmacist in Australia. Okay?
Yeah.
So
4 years plus a 1 year internship, so technically 5 years.
Technically 5 years. Oh, so that's similar to Indonesia. 4 years in undergrad and 1 year apothecary program. Yes, so that's the similarity of when you become a pharmacist. Are there any questions from you, Mayla?
Okay, thank you, Ms. Wei. But I also have a question. If there is in Australia examination like UKAI in Indonesia?
Is there any examination? Can you repeat that, Mayla, please?
Yes, I think that's the question. Like, if there is in Australia has UKAI like competition, uji kompetensi seperti itu.
Oh, okay. Yes. Are there any competency tests for pharmacy students for them before they can, practice as a registered pharmacist in Australia?
Yeah, lots of competency-based exams. Yes. So during the internship, they would have to they have to complete a certain amount of hours. They have to then complete a competency-based single best answer question or multiple choice question theory test. And then they have to do what we call an OSCE or an oral viva examination. So multiple parts of exams, but oral and all competency based as well. So it covers drug knowledge, so medicine knowledge, proficiency at decision making, communication, skills application, ethics and legal knowledge and clinical aspects. So lots of them. Yeah, lots of them.
So it's not easy to become a pharmacist in Australia.
Oh, I mean, if you follow the process and you do your work, it's achievable. Nothing is easy, but it's achievable.
Yeah, it is. But I do think there's a big gap between the how to become pharmacist in Indonesia and Australia, as we know, Faye. Considering the advanced knowledge and skills that the Australian pharmacists have compared to Indonesian pharmacists, but we'll get there through one day. So don't worry, Mela, we will get there. We will become, as well as advanced as pharmacy. There is time, but there's a journey that we must, we all need to be together in this journey as a pharmacist to achieve that, to accomplish that mission.
And learning doesn't stop, Mela. Learning doesn't stop. So because right now, I graduated in 2008. What I learned at that time during my uni days, pharmacy is very different now. So pharmacy will be very different when you graduate, when you become a pharmacist 5 years later, 10 years later. It will continue to change and continue to evolve. So learning doesn't stop. So, and competency-based learning doesn't stop. So you might do competency-based exam now, but 5 years later, you have to do more learning and so on. So it's very exciting, but it's good for us. So you have to always do professional development.
Mm. Yeah. Okay, I think is that answering your questions or your curiosity, Mela?
Yes, it enough me. Thank you for the answer, Miss Faye.
Thank you.
Okay, I think one more question, Faye, from Adinda Putri Febrina. Can you hear me, Adinda?
Yes, Miss. Okay.
Yeah.
Thank you, Dr. Faisim, for the knowledge. It's very interesting for me. In my view, the role of pharmacists in Australia is very high and focused apart. Permission to ask, I just want to know regarding the role of pharmacists in pharmacist or drugstore in Australia, how many pharmacists do each drugstore usually need, and whether it already has its own job or can it also be a double job, such as dispensing drugs and also providing service to patients. Thank you, Dr. Faisim.
Thank you, Adinda. Sorry, so the question was, can pharmacists do more than one thing? Is that what you're saying? In a pharmacy, they dispense and they do services. Yeah, absolutely. So if you're a community pharmacist in a community pharmacy, your every day is different and you do multiple things every day. So for example, when I work in the pharmacy, I might be giving injections, giving COVID injections in the pharmacy, COVID vaccines in the morning, and then afternoon, I might be doing medication review. And then in between patients, I might be dispensing. So it can really vary. You really need to do a lot of things, be very flexible, but also it would always come back to the workflow within the pharmacy. If you work in a team, Adinda, there's often if you're the manager, you will work out whose role is to do what in the pharmacy that day. So yeah, it really varies, but it's very exciting.
Mm. So in Indonesia, pharmacists can work in 3 different places, in three different community pharmacies, as you know. Is that also happen in Australia? Can they work in more than one place?
Yes. Yeah. They can also work in more than one pharmacy or more than one different setting. So you can work 2 days in a community pharmacy, 2 days in a nursing home, or 2 days in a GP clinic. And yeah, definitely.
Does that answer your question, Adinda?
Okay, thank you, Dr. Faisim, for the wonderful answer.
Thank you.
Welcome. So there is a question from Mariam. It was Mariam before I think she couldn't access her speaker, so she wrote on the chat box. She has 3 questions here. The first one is, the meds check a must thing to do for every patient that visited doctor, because she thought it was a bit of a complex process on the meds check. And the second one, why diabetes have its own meds check, and why not other disease such as heart disease, or maybe other diseases as well. And the third one, this one is quite her curiosity about whether she can work as a pharmacist in Australia if she already become a pharmacist in Indonesia. So can she work as a pharmacist in Australia later on if she has graduated as a pharmacist in Indonesia? So she has 3 questions in there.
Thank you, Vinci, and thank you, Mariam. So the first question, meds check is not a must. It really is based on the professional judgment of the pharmacist, whether the patient needs to, will benefit from a meds check or not. So the pharmacist will make that decision if the patient would benefit from it or not. So it is not given to every patient. Also, the patient has to agree to do the service, because they might refuse and say, I don't have time, or I don't need this, or, so it's not compulsory at all. The second question, meds check is generic. Reason why there's a specific one for diabetes is because there is a high prevalence of diabetes in Australia, and diabetes, people living with diabetes have very complex needs, because, for example, there might be more conversations around how to use their blood glucose monitors, how to monitor their blood glucose levels, how to do certain other things to check for macrovascular and microvascular complications from diabetes, for example. So it does take a bit longer than normal meds checks to do. So you had asked a good question. Why not other types of meds checks, like mental health meds check, or pain meds check, or heart, cardiovascular disease meds check? And the answer is yes, there is definitely a need for all of those things to happen. But the 2 examples I gave, the diabetes one was the program that is funded by the government. There are lots of other trials at the moment funded by specific research trials, but looking at pain meds checks, mental health meds checks, for example. So there are these other things, but they're not standard programs by all pharmacies because they're not funded by the government. The third question, I'm really happy that to hear that you are thinking about coming to Australia to work. So this is really good that you're thinking about your future. So Vinci actually came here and did a PhD. So, you might be thinking there are a lot of avenues to be here. So if you are registered in Indonesia, you will not be able to become registered in Australia automatically. But depending on which university you graduated from, what degree, whether you did apothecary and so on, you need to apply to the pharmacy board of the pharmacy board here, and you may need to do your intern training program, which is usually about 10 to 11 months of work, and then pass the competency-based exam. So we have lots of pharmacists who come from overseas. They're overseas qualified pharmacists, but there is a process for you to gain qualification here in Australia. So I think every person's situation is unique. So if that's what you're thinking, when the time comes, I would recommend that I'm happy for you to get in contact with me, or I can put you in contact with the registration board for you to find out exactly the steps that you need to undertake to do that. Vinci, I also realized Amalia Daryati asked a question in the chat as well. So Amalia wanted to know how to manage medication management for elderly patients who usually lose or forget their medication. So Amalia, I think if I'm correct, you're asking if people, if they have memory loss or if they have cognitive impairment, they don't remember, you can't rely on their memory. So you asked a very good question, because in those circumstances, you would have to see if the person actually has a carer with them, someone who cares for them that can actually be able to provide that information. But also right now, I'm involved in, it's quite similar to the answer to Mariam, because I'm currently involved in a research project. It's a pilot program to develop what we call a dementia meds check. So it's a meds check specific for people with dementia, people living with dementia. So it's exactly to address the point around if they have cognitive impairment or they're not able to recall certain things, how do you gain information from them. So it's more complex, but it's definitely doable, So we don't have any published tools at the moment because the pilot program is still currently being in the process of being undertaken. But once the report is finalized, then it will be available, and then other countries can use that as well.
So, does that answer your question too, Amalia? Amalia. So those research or just started this year, the dementia research just started this year. Oh, wow.
Yes. Yeah.
Oh, that's
And
interesting.
this is with Dr. Andrew Stafford, who is a senior lecturer here at the Curtin Medical School as well. So Dr. Andrew Stafford is an expert pharmacist in dementia. So that's a project that he's leading.
That's interesting. So we would like to know when you have published some of these the research, so they can learn what can dementia do and what pharmacists can do as well. So later on, I think we will stop the questions. No, I think
Nurahim had his hand.
His hand. Nurahim Abdul, do you have any questions? Yep.
Yes, I have.
Oh, good. Okay.
Is my voice clear?
Yes.
Okay. I'm sorry for let's question. I have one question. What is the biggest challenge in telehealth service? That's it.
The biggest challenges in
telehealth service.
Telehealth services. So what is the biggest challenges when we're doing the telehealth services?
Biggest challenge? Well, biggest challenge is, I would say, unstable internet, because many people who have to do telehealth, especially if they live in rural and remote areas, because they can't come to the pharmacy, so they're in remote areas, sometimes the internet connection is not very stable. So that's the most challenging. But the other challenge as well is, imagine if you have someone who has poorer technology or digital health literacy. So what that means is they might not know how to use computers. They might not know how to set up their internet. There might be some elderly patients that you're trying to help that are not good with their computers. So it might be quite hard to engage them in that way. So in those circumstances, telehealth means you can also do a phone call, as simple as a phone call. The other challenge as well is because you're not seeing the patient. Sometimes if you're trying to give some advice about how to use your asthma inhaler, they're not right in front of you. You can show them via the screen, but if they do it wrongly or whatever, it's quite difficult because they're not there in front of you. So those are probably the immediate challenges that I can think of. But good question.
Does that answer your questions, Nurahim?
Yes, actually that is my concern too, because telemedicine is one of problem in especially in rural area. Thank you so much, Dr. Fei, for the answer.
You're welcome, Nurahim.
I was just remember when I did my interviews, data collection, where I had to do the interview, the pharmacists, some of them were in the rural area, where I had to repeat and to confirm again and again and again. So I think that's also the challenges when you need to talk to the patients using telehealth. You need to reconfirm and confirm the patient again, their condition and everything. So yes, it's a big challenge, especially when Indonesia has so many remote areas around here as well, with unstable internet connections as well. So are there any questions again from you guys? Or if you have any questions, you can write it down. You can send it to me, and I'll make sure to send it to Faye. Or any inquiries or anything that you would like to know, you can send them to email to me, and I will make sure to send it to Faye, and absolutely you will get the answer from that. So don't worry if you have if you're a bit shy. Maybe this is the first time of having the international lectures, particularly with the practicing pharmacist and with the president of PSA board, Faye. So I told them, I think they're prepared enough for the lecture, but some of them might quite shy. Hopefully we can see many questions next week when at the second lecture from you. And also this was a very insightful lecture from you, Faye. Thank you very much for giving them, insightful knowledge about how pharmacists in Australia did their job, and we can see the comparison with the Indonesian pharmacists as well in here. That there's many big gaps that we still need to catch up with the Australia, maybe New Zealand, UK, and everywhere. So this is homework for all of us, not only for me, but all of those future pharmacists here, Faye, when they graduated and when they become a registered pharmacist as well. So hopefully with these lectures, they can learn many. They open their understanding about how pharmacists practicing in community pharmacies in other clinical settings everywhere. And there's big job as a pharmacist. Don't worry that you won't get any job as a pharmacist like what Faye lists. There are so many pharmacists can do even in Australia and in Indonesia. So as a future pharmacist, you're also a lifelong learner. As what Dr. Tin Pei Sim told us, we will never stop to learn, researching, learning, and everything that's part of our as a pharmacist, as part of knowledge in a pharmacist. So I think that is for today's lecture. Okay, thank you very much for your time, for giving the lecture to these students. I'm very happy to have you here. We are all happy to have you here. And hopefully we can see you next week for the second lecture in the international guest lecture. So everyone, I hope you all stay healthy and safety. And we will see you again next week. I will close this today international lectures. Thank you very much, Faye, for your time.
Thank you all.
See
See you next week.
you next week. Bye.